Hi, I am Dr. Rajaram and I will tell about tonsillitis. Before telling tonsillitis, I will tell what is tonsil. The tonsil which present below the tongue, that area known as palatine arch. Tonsil is very important in our body. It protects against pathogens like bacteria, virus, which enters in our body through the mouth, and it act as a barrier to our throat, and it also improve immune system, and sometimes the inflammations of tonsil is called as tonsillitis. So tonsil get enlarged. If you check with torch, you will see the swelling of tonsil is called tonsillitis. So tonsillitis is a self-limited disease, and what is the cause? Why the tonsillitis occur? What the reason? So infections like bacterial infection or viral infections, and infections like rhinovirus, coronavirus, which is causing tonsillitis, and sexual active patients like HIV, gonorrhea, and syphilis, and common cold, low immune system, and having cold items like freeze items or cold drink or ice cream, change of climate or cold climate, and other infections like tuberculosis, HIV. So these are some causative factor for tonsillitis. What the symptoms you are going to see here? Fever, and sometimes fever with chills, throat pain, and difficulty in swallowing called dysphagia, and redness of tonsil or erythema. And you in examinations you will see there is a swelling in tonsil and some small white patches which indicate severe infections or sometimes abscess, and a common cold and sometimes cough also. And this is the some common symptoms for tonsillitis. So how you will evaluations, how you will evaluate and how you will examine. So during examine or evaluations, you see you will find erythema, redness of tonsil and white patches, and you can see it is visible. You can see in with the help of torch light, and tonsillitis. If person is suffering with tonsillitis, patient doesn't require hospitalizations because it is self-limited disease. And now, what is the treatment here? As I told, tonsillitis is a self-limited disease, rarely required hospitalizations, and sometimes tonsil occur like in 6 months or 3 months or 4 months or 1 year. It is called recurrent tonsillitis. And here, as you know, because of infections, the tonsillitis occurs. So the antibiotic, short term of antibiotics like 3 to 5 days, NSAID for pain, and if fever, antipyretics, and other common cold or cough. So you can give anti cold tablet and cough syrup. Along with that, you need to avoid cold items and visiting cold place, and do hot water gargling, take kashaya or black tea, and follow some precautions like maintain hygiene and take hot water bath, and within 3 to 5 days symptoms will reduce. and short term of steroid also required, like one dose, but make sure that patient is not having diabetes. And as I told you, the precautions and treatment. And if someone getting recurrent tonsillitis, so they have to take care prior to this tonsillitis. How? Like if climate change or rain, so they have to be prepared. So before that, they should avoid visiting cold place or rainy season, or they should avoid cold items, and they can continue hot water gargling with drinking of hot water, and it is very helpful. And please share this video. Thank you so much.